Hi, I'm Carrie, and I'm a registered nurse from the clinic here in town. Thank you for inviting me to your middle school today to talk to you about blood pressure. Some of the things that we're going to talk about today are what is blood pressure, how do we measure it, what's high blood pressure, what causes that, and what are some ways that we can prevent from getting high blood pressure. First off, what is blood pressure? Blood pressure is the amount of force that it takes your heart to pump the blood throughout your body. A lot of times when you go into the clinic, they'll use an automatic machine kind of like this one, or some places use a cuff and a stethoscope. And when they do that, they'll give you two numbers, like 120/80. So what do those numbers mean? That 120, that top number would be your systolic pressure. And what that is doing is it's telling us how much force your heart has to pump to get the blood to go through the artery. That bottom number, that 80, would be your diastolic number. And that's telling us how much pressure is still on your arteries when your heart is at rest. So we have a 120/80. That is considered normal blood pressure in an adult. So when we talk about high blood pressure, what is high blood pressure? High blood pressure is when those numbers start to go up. We have hypertension is what we usually refer to high blood pressure as in the clinic. And in adults, when it gets to be like that 140/90, then we can tell somebody that they have hypertension. In kids and teens, we do that a little differently. And what we do is we tell children or teenagers if they have high blood pressure, that means that they have a blood pressure reading that's higher than 95% of the kids or teens of the same age, height, and gender. So that means 95% of those kids have lower blood pressure than you would. So that would be high blood pressure. A lot of times we call hypertension or high blood pressure, we call that the silent killer because there's not many symptoms. People walk around with high blood pressure and feel perfectly fine. Sometimes people will say, oh, I have a headache, or they notice that they have some vision changes, or they get a little dizzy if they stand up or sit down too quickly. Then they'll feel a little off. Hypertension, we worry about it. Why do we worry about it? It leads to heart disease. It can lead to a heart attack, stroke, vision loss. It puts a strain on your kidneys. Your kidneys have to work harder when your blood pressure is higher. So what causes hypertension? People who have certain medical conditions can get hypertension from that. If you take certain medications, sometimes medications will make your blood pressure go up. Genetics. What we're born with. We don't get a choice of what things mom and dad and grandmas and grandpas pass down from generations. Diet and exercise. And diet and exercise are probably the two most important things that we can do to prevent hypertension. In a study that was published in the New England Journal of Medicine, they talked about how adolescents that had an increased BMI, that is your body mass index, and we take that and we look at how tall you are and how much you weigh. And is that in a normal range? So that would be your BMI. And adolescents that had an increased BMI were at a higher risk for having problems with their heart as they progressed through adulthood. They had a higher chance of having hypertension, which then leads to coronary artery disease, heart attack, stroke, things like that. So we want to watch what we do. How are things what can we do to prevent high blood pressure? First off, we can exercise. 30 minutes a day is what is recommended, and we want you to do aerobic exercise, which is cardiovascular exercise. We want you to get out. We want you to break a sweat. We want you to be, breathe heavier. We want that heart, which is a muscle, we want it to work like any other muscle in our body. We need it to give it a good workout. Sitting at home playing video games is not a good workout for our heart. Eating a variety of fruits and vegetables. Fruits and vegetables are a good source of energy for our body. That'll help do our 30 minutes of exercise every day. We want to make sure that we're decreasing the amount of fats and sugars that we eat. Candy bars, cakes, cookies, sodas, those are all things that should be a treat. That shouldn't be a daily food that we eat. We also want to watch how much salt or sodium we're having in our diet. Things like stuff out of a can or popcorn, when we add salt to food, that will increase our sodium intake, and that makes our heart work harder. Also, not smoking or drinking any type of alcohol. Those are all things that make our blood pressure go up. So, what did we learn today? We learned what blood pressure is, how we measure it, what's hypertension, and how do we determine who has hypertension, and ways to prevent that. We only get one heart in this life, and we want to make sure that we're keeping it healthy. Thanks.